An ectopic pregnancy is one of the most serious complications in early pregnancy, and sadly, many women don't even know what it is until it happens to them. Let me explain. Normally, after fertilization, the embryo travels down the fallopian tube and implants inside the uterus, where it can grow into a healthy baby. But in an ectopic pregnancy, the embryo gets stuck and implants outside the uterus, most commonly in the fallopian tube. The tragedy is that while you are technically pregnant, this embryo cannot develop into a baby. About 1% to 2% of all pregnancies are ectopic, so it's not as rare as people think. The problem is that it's often missed in the early stages. Symptoms like mild abdominal pain or light spotting are easily mistaken for normal pregnancy changes. Even doctors may not suspect ectopic pregnancy until it becomes obvious. Unfortunately, by then, the tube may rupture, a medical emergency that can even cost a woman her life or her tube. Now, if you've had one ectopic pregnancy, your risk of another is higher. Many women assume that if one tube was affected, the other will be fine. But that's not always true. The real problem is often functional damage. The tube may look open, but the tiny hair-like cilia inside, which are supposed to move the embryo towards the uterus, may not work properly. And there is no test that can check this function. So what can you do? The key is vigilance. The next time you suspect you're pregnant, don't wait. Inform your doctor immediately. Early monitoring with beta-hCG blood tests and transvaginal ultrasound is the safest way to confirm that the pregnancy is inside the uterus. If an ectopic is caught early, it can often be treated with medicines like Methotrexate, avoiding the need for emergency surgery. I always remind my patients an ectopic pregnancy is a tragedy, but a second ectopic pregnancy is a preventable catastrophe. With awareness and proactive monitoring, you can protect your health and your fertility. And remember, even if both fallopian tubes are damaged or removed, IVF remains a safe and effective option because it completely bypasses the tubes. If you ever feel uncertain or want personalized guidance, you can book a video consultation with me. The right advice at the right time can make all the difference.